All right, hello, my name is Kiana Smalls Ludovico. I am a nursing student here at Nightingale College, if you could see that. I'm gonna be performing my NG tube insertion skills assessment video. Okay, so before going into the room, I would obviously check the doctor's orders and make sure that we have an order to insert the NG tube. And per my EMAR, let's say it's to do some enteral feeding through it because our patient is having a hard time getting all their nutrients in as needed. Going into the room, I will wash my hands, make sure I glove up, and introduce myself. Hello, my name is Kiana. I'm going to be your nurse today. Can you please tell me your name and birthday? Hi, my name is Tina Jones. My birthday is 7/6/1992. Okay, great. Thanks for verifying that for me. Today we got an order to place an NG tube just so we can do your enteral feeding, just so you can get all the nutrients that you need, okay? Does that sound good? Tina says yes. Okay, so we're going to go ahead and proceed. In front of me, I have my little wash bin in case Tina throws up or gags a little bit or any spit up. Let's say I have a towel as well, I would put that here. Here's my cup for her to drink while I'm doing the procedure. Here I have my NG tube, and right now I am having it warmed up in some water so it's more malleable. I have some lubricating jelly. I have my piston syringe. I have my tape here in the little pants formation that the evaluator said in the video. And then this is my pen light. Okay, let's go on. So before I go ahead and do the procedure, I'm gonna inspect the nares and make sure there's no obstructions, no any concerns, abnormalities that could prevent me from putting in the NG tube successfully and prevent her from breathing properly. So I'm gonna ask her to look into her nose, and then I will inspect both sides. And then along with that, I'm gonna close her or have her close it. One nostril, breathe in and breathe out. Breathe in and breathe out. Okay, so let's say her left nostril actually looks a little better and has better airflow. So we're gonna go with that. Okay. Now we're gonna get ready to put it in. Anyway, sorry, I don't know if I said it earlier. I wash my hands, put on my gloves, right? It's kind of hard when I'm not in the actual room. Wash my hands, put on my gloves before I even touched her, by the way. Okay, now let's continue. Our water's already warm. We got this set up. Cool. So before, I'm gonna measure her first. So we're gonna go from the nose to her ear to the xiphoid process, okay? And the mannequin is really short, but let's say it's 50. We'll say 50 on a real human. Okay, so I would go here, go to the ear, and then again, we said it's 50. Okay, perfect. Let's go ahead and start. So now my tube is ready to go. It's all warm and malleable. And then I have my lube here and then the water for her to drink or whatever she feels like drinking. Okay, Tina, we're gonna go ahead and start the procedure. I'm gonna have you look up at first, okay? Just a little bit forward. Obviously, we're making sure her bed is high Fowler's. Don't know if that's obvious. Okay. So I dipped it in the lube. We're gonna go ahead and insert it. Little. Okay, I see it. Little by little. And then as soon as she gets any kind of gag, I'm gonna have her look down. And then I find it easier during that time when she feels a little bit of a gag, I'm gonna have her take a few sips of water. And then with each sip, I'm gonna put it in about 2 inches further. So she's drinking. And again, I'm having her tilt her head forward now. She's doing a good job. And when she feels the gag, that's the oral pharynx, that like curve. Okay, we're going in, we're going in. Good job, Tina. Sorry, I'm pulling it from the back to try to get it to go in better. Okay, perfect. And then we're at 50 here. Awesome. Okay, perfect. And then now that it's in, we're going to go ahead and there's two ways to check it. So I can like aspirate it a little bit. I will aspirate it from here. We would remove this part. And we would not do this because this is the vent. Okay. So coming from here, aspirate it, make sure we get some stomach contents. And if we do, per the facility, if we have like testing strips, we would do about, like we would put it on the testing strip and it should be around like three pH balance, 3.0, 3.5, around there. And we would just dip a little bit and test it. Or my facility that we usually go to, that I work at, we just go and do the x-ray to verify the placement. That's like our best bet. So okay, cool. Make sure she's comfortable. I'm gonna go ahead and tape this. There also is at my facility, I'm really not used to doing this like pants method, but my facility, we have like a special thing for the NG tubes that go on the cheek, because I actually work with kids. But we would go ahead and place this comfortably along the side of her face, and then we would make sure to tie it to the gown. We could use like a little pin or whatever works to keep it away and out of her way. All right, and then once placement is verified by the x-ray, I would then proceed with her order. So for her, the order was for the enteral feeding, so I would connect it to her feeding pump. We have like kangaroo pumps at my job, so I would just connect her to that, and then we'll call it a day. Perfect. And then before I leave, I would say thank you so much for allowing me to do this procedure for you. Wash my hands, and then, well, don my gloves. Take off my gloves, wash my hands, and then leave the room. And should she have, so during the procedure, if she had any issues, I would have just removed it. Like let's say the placement was wrong, I would just remove it and totally just restart over with the new tubing. And let's say she had thrown up or something, or like she was gagging like crazy, I would have just pulled back, given her a break if she needed. She could have taken more sips of water, and then I would have continued forward. Or I could have also just restarted the whole procedure in general, depending on the comfort of my patient. And that's it. Thank you. Bye.